What can you tell us about these cases that are rising in the Jogabi district?
Well, thanks. As you would recall that we started last week when the outbreak did come out, where ultimately we had 102 learners, and amongst those we're having fewer teachers, but also we're able to go to the communities to do testing following all those contacts that we had. We did that. Why I said today we're happy, because the 102 that were the first to be tested on the 13th then, and from the 11th, 13th, 15th, are people now who are out of the woods and are okay. But what we have subsequently seen is that as the areas like Alwa North, Middleburg, Craydog are in one mid-Karo area, and almost to a certain extent are one area, Bagelsdorp, you find that we've got other cases, but all these cases emanate from schools and are centered around the communities. They would be learners, they would be teachers, but there will also be a few of the community members. In all this, we've lost 2 people, 1 learner and 1 adult. Now what we are doing, we are worried about what is happening in the prison in Free State, and we're hoping the working relations of the Eastern Cape and the Free State shall actually yield that we test the area so that we can be sure. Because the challenge with us is that you cannot separate people from Alwa North and Free State, because those, to a certain degree, are one kind of community. So those are worrisome factors to us. As such, we've just registered now in all these areas I've mentioned about 192. Looking at that number, as long as we do not have fatalities, as long as we do not have serious people, we are hopeful that they are also going to recover.
One might say this is a possibility of a second wave. How prepared is the province for a second wave?
You are right to say this could be a possibility of a second wave. It's a second wave we've been actually anticipating. Hence, you are not seeing us lost. We're not clutching straws. Our systems are in place, our structures are in place, and we're on top of things. Hence, we're able to say we can even go to assist and test the whole prison community if need be. However, if I am saying the wave has not been seen in other areas, you will go back maybe to statistics freshly now and find that areas that we're always worried about, when you go, for instance, to Port Elizabeth, you find that only we've got 6 new cases. So in a sense, we are, it's what we call clutch balancing.
Okay.
Figures are giving us good this side and bad that side. And even in terms of deaths, Buffalo City, for instance, only had 3. And you know Buffalo City, where it comes from, we used to have big numbers of people who are passing on. So I'm saying we are still on the alert. Our guards are not down, and we are ready at any minute. Our structures have not been dismantled.
We are on lockdown level 1 now, which involves a lot of traveling. A lot of people are moving around. Some of the restrictions have been lifted. Some people are of the view that the lockdown is over in the province. What do you say to such people?
I do want to appeal to many people who want to believe that lockdown is an indication that COVID is over. That's the biggest mistake that our communities are actually making. Secondly, it shall put a lot of strain on government, whether it's Eastern Cape or whoever, if our own people can be careless at this point in time, because it only takes one stick of a match to light the felt. Secondly, our structures, as I say, are not dismantled. For instance, as we speak now, as I was coming here, the whole IMT meeting was on, which is chaired by Dr. Zungu every morning from 7:30, with all the districts linked, so that our structures are still strong. We know exactly what our challenges are, and we know exactly where to actually strengthen as a group. I would still impress that our communities keep their masks, is informed. Secondly, they keep the distances, as both of me and you and me are doing. Thirdly, they still continue to wash their hands. And at the slightest suspicion that they might be having flu, which is a bit abnormal, even normal flu, we are urging them to come forward.
All right, so let's catch you